The advancements made in the healthcare system in Delta State, South Nigeria, amidst challenging vulnerabilities being experienced in the country, is no doubt grounded in the management and strong leadership principles of Governor Ifeanyi Okowa. The governor in the past 6 years has remained an advocate of health and wellness and has persistently brought healthcare closer to everyone in all walks of life.
His Excellency's vision of creating health prosperity for all Deltans is superb, and we, the operators, have decided and ensuring that vision becomes to full reality for Deltans.
Our governor, to say the least, is to say he has done excellently well. The health sector has gotten a big lift in terms of infrastructure, in terms of personnel, and also in terms of training. He has done excellently well.
Dr. Okowa has not only made health his priority, he has surpassed and outsmarted all other governors that this state has ever seen since 1991.
As an important element of state security, the state government, through the Ministry of Health's well-structured policies and programs, have never ceased in strengthening governance and improving the efficiency and effectiveness of the health system across the 3 senatorial districts in the state. Governor Okowa's stability at giving the delivery of health services priority attention has rapidly advanced the health indices of the population in Delta State.
Before now, we all know what the health facilities are in Delta State. And the coming of Okowa made all the difference. I wouldn't want to say that because he's a medical doctor. No, but because everything he has done pervades all sectors.
There's no gainsaying that health has taken a place of priority in this administration. If you go to every central hospital in Delta State, there's a presence, just not only a roadmaster, he's also a health master.
Our governor is an intelligent person. You know what is paramount to Deltans, health for all. He's already completing his agenda he promised Deltans.
Sun Delta. History was once again made on the 15th of June 2021. On this day, the state took the celebration of its season of harvest of projects a notch higher when one of the state's top-class health infrastructures was inaugurated. Governor Ifeanyi Okowa hosted his Adamawa State's counterpart, Ahmadu Fintiri, at the Asaba Specialist Hospital. Alhaji Fintiri commended Governor Okowa for the great leadership traits he has demonstrated that has culminated in numerous projects being inaugurated across the state.
His Excellency Dr. Ifeanyi Otto Okowa, a leader in every sense of the word, overwhelming that he chose no other occasion to invite me to Delta State than the ceremony of the formal commissioning of the Asaba Specialist Hospital, a giant project which will no doubt positively impact the life of the people, change the narratives of secondary healthcare services delivery in Delta State. The projects I have seen in Delta State, which include the specialist hospital, is a clear testimony that with more devolution of responsibilities and resources to state, so much can be done.
The governor, during the event, urged government at the national level to ensure the National Health Act is given full operational status.
And I'll call on the federal government to please ensure that all funds as contained in the National Health Act is released, and 50% of that fund actually goes into health insurance for the vulnerable. And the most vulnerable in our society today are the pregnant women and children under 5 years of age. And if we can truly fund the health insurance cover for this set of people, we'll be saving a lot of lives.
The joy expressed by Deltans was affirmed in the dancing and singing at the event. women and indeed residents of Delta have continued to celebrate the free health care enjoyed by the vulnerable, especially young children and women in the state.
Our governor has come to open this hospital for us, and he's very conscious of health because he's a medical doctor, so he does not joke with anything else. That is why we are happy.
He has done a marvelous work. This is a modern hospital, and it's also a blessing to humanity.
I thank the governor, Dr. OKOWA'S, because he tried for accommodating everybody. Whether you have money, whether you don't have money, we all come here to take free medical care.
The 220-bed facility with 11 inpatient wards remains a source of joy to Deltans and has been described by many as a blessing, beyond easing the workload of the Federal Medical Center Asaba and providing health care to other neighboring states. The health facility is the actualization of the healthcare component in the Stronger Delta agenda of the OKOWA-led administration.
A project like this is very much welcome, and for the citizens of Delta State to benefit, as well as those that are resident here but they are not citizens. You know that as this place is being commissioned today, it will slow down the influx of patients into the Federal Medical Center. So if you have an emergency, you are sure that you are closer to a health facility.
Immediately he came into power, it was something that was very dear to his heart. Perhaps because he's a medical doctor, he wanted to do something that would really, really touch the lives of people medically. We have state-of-the-art facilities.
The hospital here, they don't pay money. Everything here is free. That is the reason why I came. Even the day that I came to register, they did not collect any penny from me. I was in kind of Oshu, because in Lagos when I gave birth for my first child, I paid money in there in General Hospital there. So when I came to this place, they said I not used to pay. Even their drug is free.
We are nurses and we are called to serve.
Speaking to medical practitioners in the facility and attendees at the event, they are thankful for the initiative which the governor, who is also a medical doctor, has brought to bear, as it has made their service to humanity more enjoyable.
Our coming here is our duty and is a call to come here and take care of my patient so when they get better. So it's been an honor working with the state government.
The governor of Delta State, being a medical doctor by profession come politician, has actually improved on the health of Deltans. And don't forget, while he was in the Senate as a chairman health committee, he actually came up with bills that calls for the improvement of health in Nigeria as a whole.
24-hour service is going on here with high-level professionals in the entire South. I doubt if you can see any of this replicate anywhere. And all of this, we owe it to God Almighty and owe it to His Excellency, the Governor of the state.
Smart Delta.
Oni, how is our child?
Our child is fine. Governor OKOWA is ensuring that we have sophisticated medical equipment to deliver good healthcare services here in Delta State.
I am aware Governor OKOWA upgraded facilities at the Delta State University Teaching Hospital, Ogara.
Daddy.
Oh, my daughter, how are you?
I am fine. The doctors say they will be discharging her soon.
Governor OKOWA improving Delta State healthcare system. Smart Delta.
Healthcare has been a hot career destination for many. Hence, the Asaba Specialist Hospital has engaged professionally trained doctors, nurses, paramedical clinicians, and other skilled staff of over 350 who have been on the ball and invariably ensure that the day-to-day operations in the hospital are running seamlessly and furthermore maintain the set standard of this medical center to the letter.
It has been marvelous for the workers, the patients, and everyone around the environment. He has done more than well for Delta State. The years of his governorship, it has been perfect.
The medical workers are very happy, at least for the environment, which they now see as more appropriate and pleasant for work. The care that the government has also taken care of them. That is to say the workers, not just the patients alone.
I like the hospital. It's very, very neat. This is my first government hospital I've ever seen. Very neat. Me, I don't like government hospital, but this one, I give them 100%.
Smart Delta Media team was taken on a tour around the hospital, which sits on an expanse of approximate 4 hectares, equipped with 11 inpatient wards. We met with Otuya Emeke, a dentist on duty, as he spoke to us. He also allowed us to capture the demonstration of how he treated his patient.
In this area, we're going to break with using our handpiece. We have the instruments here. We break this area. I have to commend the management of the hospital and also the government for the way they've been making everywhere is clean. In fact, no deaths around. It's constantly kept clean.
Dr. OKOWA is really trying. He has done well by establishing this hospital. Commending that he should still do more.
The hospital standard of operations.
When speaking to other caregivers on call, they pointed out that the chain of command in the hospital has been cordial, and the quality of healthcare facilities in the hospital provided by the state government have made the hospital exceptional.
The hospital standard of operations is really high. The doctors, everyone here works almost seamlessly. Things move very well. Patients come in, they have all the departments in the hospital. They have access to everything, very good healthcare that I feel that is rivals even tertiary institutions all over the country.
This is the first time I'm actually getting to experience the digitalized work experience here in Nigeria. I must say, working with it, and it's quite top notch. They are doing well, and I believe I'm doing my best to give them a satisfactory result at the end.
Senator OKOWA'S commitment in the delivery of healthcare services in the state is spot on. Hence, the specialist hospital has seen, managed and treated patients of over 70,000, including 30,000 children under 5 years and 23,000 pregnant women who have all benefited from the free health care provided by the OKOWA-led administration through the Delta State's Contributory Health Scheme.
Through his strategic and significant political will, we've been able to establish the Delta State Contributory Health Commission and the Delta State Contributory Health Scheme, which by the grace of God happens to be the #1 healthcare financing institution in Nigeria. We've been able to achieve over 20% enrollment of the Delta State residents, and we are targeting to achieve universal health coverage through at least a minimum of 70% coverage within the next couple of years.
I'm here for antenatal. The medication, the laboratory, the scan, everything was done free. Thanks to the governor who made it free for us, especially to the poor masses.
We came from Agbo. I came with my daughter, and since then I've been coming. The nurses and the doctors, they are really trying their best. They are attending to everybody, and we have never paid one kobo for everything. I know it's not going to remain the governor forever. Wherever he's going to, God will be with him and bless him the more.
It is pertinent to note that this has led to the delivery of over 800 babies without charges from booking to childbirth, and this has drastically reduced the mortality rates of women and children. The hospital has had 1,013 adult admissions, 734 under 5 admissions, 970 free maternal admissions, and 245 neonatal admissions.
I registered for antenatal on December because I normally register on time if I take in due to I don't used to be that strong. From that December till now, they've been taking good care of me. And when I put to bed, it was through CS I used. Everything was successful. I give God the glory, and it was free of charge. I did not pay dime.
We've been coming here since last year. We've enjoyed their health skill, and we are so grateful because it has eased us a lot of financial stress. Government have done a lot. Like this one now is very expensive, and we're getting it free here. The attention goes round, not just for the Deltans, for everybody. I'm from Akwa Ibom, so you can see I'm enjoying it too. So we are most grateful.
They have 2 kids. The other one just got discharged a week ago from here, and it was free as well. These 2 free as well. So it has lessened the burden of paying for medical bills. I know it's always huge paying for childcare. So the government have taken care of that, and we are very grateful to the governor.
Amazingly, a set of twins born prematurely at 26 weeks have been successfully managed at the Pediatric Special Care Baby Unit, and both children are currently doing well and meeting their entire expected developmental milestone at 8 months of age.
We have a lot of them, but this specific one, they came out in 25 weeks gestation. The woman is an Hausa woman. She came in, she delivered there. They were about 0.5 and 0.6 kg. So we took good care of them and they were discharged after 3 months. It's a great privilege to be here. And ever since I came, I've been happy with myself. Anytime I go home, I go home fulfilled.
It's an avenue where usually mothers give birth freely here. Then their children are being nursed in this place. For they have free incubators. We have oxygen. You can see it's just planted like we just fix it and put it provided for them.
The hospital has certain peculiarities, one of which is the world-class Sickle Cell Referral Center situated in the facility to improve the lives of persons living with sickle cell disorder. The center was birthed and fully funded by Dame Edith Okowa, wife of the governor of Delta State, through the O5 initiative and her partners.
Every one of these clinics is fitted with modern equipment, quality furniture, and manned by skilled and knowledgeable personnel. Our conviction that people with sickle cell disorder can live normal lives once they can easily access specialized health care provided by professional and compassionate caregivers motivated us to establish these clinics.
Sickle Cell Referral Center is a unique place. So many people have been coming. People come from Benin, they come from Anambra, Abia, Abakaliki. Even we had patients from Lagos. We do so many things in this place. We also have a prenatal diagnosis machine. The machines that are in this center, the only place I've seen a machine like that is in the Sickle Cell Foundation, Lagos. Apart from that place, I don't think there's any other place in Nigeria. So there are so many things, and this place is fully electronic based.
I'm from Owerri. Then they referred me to this sickle cell specialist from Asaba to come and take proper care of my children. For the thing that governor is doing is good, to make it in order so that people will be coming here and be healed.
With these developments made, Delta State comes to be the first state in Nigeria to be equipped with the newborn, post-newborn and adult screening machines under high-performance liquid chromatography (HPL) in the same hospital, and also boast of exchange blood transfusion, apheresis machine, and the transcranial Doppler scan machine, which determines stroke risk in children with sickle cell anemia.
We are very much grateful to O5 initiative, Her Excellency Dame Edith Okowa, and the government of Delta State for the support they have continually shown us. The HPLC machine that determines genotype at birth and the one that determines it later on from 6 months. This facility is the first facility in the country to have both machines, and we are very much grateful for this privilege that this facility has been given.
This center is the only center in Delta State and in the full federation that has 3 recently updated sickle cell determining machines, all by the Biorads, and also a new one that was brought in for us, the Gazelle machines. This center is very well equipped in handling sickle cell disorders and patients, and in the management of known cases. Now, this center also has a 24-hour power supply.
A lot of facilities are inside and it's functional. CT scan, so many things are inside. It's a big one. We thank the governor. Everyone that comes in, they are so happy.
Furthermore, the laboratory, radiology, and physiotherapy units are equipped with technologically advanced facilities. One of many is the 125-slice computerized tomography CT scan, and has also carried out 4 successful brain surgeries with the collaborative effort of locum consultant neurosurgeon. The facility also has a functional oxygen generating plant that is reticulated to all the wards.
We are extremely grateful for all this. The incubator is free, oxygen is free. I know oxygen in other places a day is about 10,000 naira. So we have children who have had to be dependent on oxygen for more than 2 weeks. If they had to pay for that, I don't think they will be alive today. So he has done enough with the oxygen, the free drugs.
Dr. Ifeanyi Okowa, the governor of Delta State, has brought this good project to take care of the people's health and has brought it closer to them. Equipments are world class. They are supplied by CMS. Most of the patients don't have to go to Onitsha or Benin for their test again.
Asaba Specialist Hospital does not just boast of these medical facilities, but also experts in different medical fields serving the needs of a particular realm of care.
Because of what we expect this hospital to provide, the kind of training that is desired to ensure that we have a very good relationship with patients have been passed down from expertise within and from outside, particularly from bigger hospitals like Desut and even FMC, where we have some well-trained hands.
Why it's called a specialist hospital is that we're doing very advanced medical technology, healthcare at a very top level in the hospital with different specialties. We've seen over 70,000 patients. We're covering in all areas.
Earlier in 2020, Asaba Specialist Hospital, functioning in full swing, served optimally as an isolation and treatment center during the COVID-19 global pandemic. The medical center had the most significant number of COVID-19 patients and ran many tests as at the peak of the plague till date.
The hospital treated most of the COVID patients. Whenever a case was witnessed in other units, they were all referred to here. The hospital was just the major injury room in the management of COVID.
This place we stand in happens to be the arrowheads for the fight against the COVID-19 pandemic. Governor Ifeanyi Okowa went further to remove discrimination between local government, state and federal. We had a very robust fight against the pandemic.
Anything worth doing is worth doing well. In this vein, the governor of the state has established a good road network, ensuring better transportation to the hospital and a stronger path of communication from major health centers.
Governor Ifeanyi Okowa is a man that came to government prepared. If you see him anywhere he goes to, he's always talking about the road network. I know in his heart, he still has other roads conceived, which he is still going to construct before the tenure expires. The road is already a plus to the people that are living in this area. So in terms of road, I give him kudos.
Me personally, I call him people's governor, the Kweme #1. And he's a governor that has the interests of people at heart. If you look at what he has been doing around, nobody is exceptional. He carried everybody along and we are enjoying it. The road was very bad as of last 2 years, 3 years. We passed here or more, but now, as you can see now, the whole place is tired. Even from here, you can link to 74.
Smart Delta.
Governor Okowa's steadfastness in providing unadulterated healthcare system desired in the state is a clear indication of his in-depth understanding of good governance. His efforts will no doubt address the health challenges and improve the general well-being of Deltans. My name is Henrietta, and thank you for watching today's episode of Smart Delta. The feedback segment. Question of the day.
I want to ask the government if they can be able to sustain this hospital in years to come.
Thank you, Batham, for your question. For this hospital, we've been able to enter into service maintenance agreements with most of the companies that have supplied us with equipment, such that when they need to be maintained, they come and do their maintenance, and then when they go bad, they also come and repair them. We engage consultants who do training and retraining of the staff in different departments to ensure that the level of care which we boast of is maintained and even improved on with time.
It's important to get informed about what is going on in this state. If you're going to pass suggestions to us as government, your suggestions will be welcome. To know more about the Smart Delta team, follow Smart Delta on their various links.
Text your questions to 08121192133 or send with the hashtag #AXIT to all our social media platforms.
You better run, come to Delta State. Come and see the good things where OKOWA'S they do. You better run, come to Delta State. Come and see the good things where OKOWA'S they do. I see your job and work creation in Delta, make the youth say them highlight. OKOWA'S. I see good roads everywhere in Delta, make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potent